of the kidney, we have the adrenal gland, and the adrenal gland has a cortex and a medulla. The cortex will make hormones that have the word cortical in it. So mineral corticoids and glucocorticoids are released here. Here in the medulla, in the inner part, this is where your norepinephrine and epinephrine are released. So this is basically the adrenaline. So when you get a rush, that's right there. Okay, so moving into the kidney, the outer part of the kidney is called the renal capsule. So you can see it's peeled away here. The kidney has two tissue types, right? The outer cortex and the inner medulla. The medulla is arranged in pyramids, so it's referred to as a renal pyramid. Okay, so the pyramid has medullary tissue. The cortex will dip down between the pyramids, and this is called a renal column. The very, very end of the renal pyramid is going to be the papilla, and the urine, which is made in the nephrons, will kind of seep out here and then be caught by the minor calyx. And then when you see the convergence of two minor calyces, say in this area, then that would be called a major calyx. And so here are two minor calyces converging. This is a major calyx. So if you have a major calyx here and here converging, right before we leave the kidney, this region is called the pelvis, so 13. The area of the pelvis, so-called renal pelvis, and then out this ureter. In terms of the blood vessels, we can see here we have the renal artery, renal vein. The renal artery comes in, and when it divides the first time, we can call this a segmental artery. And when the artery comes up between the lobes, and what a lobe is basically a section that contains a renal pyramid. It goes between the pyramids, and that's called a interlobar artery, and you can see the vein runs alongside it. That's the interlobar vein. The arteries will come across, and also the veins, they arc over the medulla, and so this is called the arcuate artery, arcuate vein. And then the ones that radiate into the cortex, these are called interlobular artery and interlobular vein. The arteries in your textbook are also called cortical radiate arteries. So either term is fine. Okay. So let's go to the next picture here. This is a blow-up of a lobe, and what we see is, in terms of vasculature, we have we have these guys coming in. This is the interlobar artery and vein. As we come up, this is the arcuate artery and vein. Here's the interlobular vein, interlobular artery. So if we follow the interlobular artery, it'll branch and basically go into the glomerulus. There'll be the afferent first, afferent going in, and then leaving as the efferent. And then the efferent arteriole will become the peritubular capillaries, which is all this blood supply around the nephron. And so that's the blood vasculature. And in terms of the nephron, these little balls that you see in the cortex, this is the renal corpuscle. And let's follow this one. So from the corpuscle, you can find the proximal convoluted tubule, the straightaway into the medulla. This whole structure is a loop of Henle. So the loop has two limbs, the descending limb and the ascending limb. And then coming back up, this is our distal convoluted tubule that's going to basically filter into the collecting duct. And the very end of the collecting duct is called the papillary duct. So 22 is papillary duct. And you can see the holes. These are all representing the openings of the papillary duct. So this region of the medulla, this is the papilla. Okay, and so there's the minor calyx that's going to catch the urine. And let's see. So just be careful, because this, we know that the PCT is on this side, but if you flip it, maybe we have the corpuscle here, the PCT is here, right, the loop of Henle, and then the DCT going into the collecting duct. Okay, so that's it for that one. On this one, this is a blow-up of the corpuscle, and what we can see is the outside, this is the parietal layer of Bowman's capsule, okay, and so if there's a parietal layer, there's also a visceral layer. The visceral layer is represented by this peachy color, and the cells are called podocytes. so their foot processes are going to form part of the filtration membrane of the glomerulus. So we have Bowman's capsule. This is the parietal layer. Here is the visceral layer. And then the glomerulus is the capillaries on the inside. So here is your afferent arteriole coming in, and then here's the efferent arteriole leaving, and we know it's afferent because it's cut away to show you these juxtaglomerular cells, and this is part of that juxtaglomerular complex. So these guys are going to secrete, oh my god, I'm forming a blank, and not erythropoietin, renin. So these are going to secrete renin to increase blood pressure. These will work with the cells here called macula densa. So this is the distal convoluted tubule, and the cells here detect solute concentration within the filtrate. So this can tell whether your blood pressure is low or high, and then talk to basically these cells and secrete renin or not, and change your blood pressure. Okay, so that's basically it. The next part is down here. This is the proximal. This is the first part of the proximal convoluted tubule. What you can see is the cells are cuboidal. So any thick part of the nephron, they're all cuboidal cells. The thin parts of the nephron, such as Bowman's capsule and such as the thin limbs of the loop of Henle, they're all going to be simple squamous cells. What's missing here are the microvilli. We really should have long microvilli because this is an area of a lot of reabsorption of substances lost in the filtrate that the body wants back. So it does not show that there. Okay, but that's that in